I really do want to thank PVA and in particular thank the leadership, Al Kovac, Sherman, certainly want to thank you. Want to thank Homer Townsend and Lana McKenzie. Thank you very much for putting this together and bringing, this is the 5th year I understand that you've done this, and it wouldn't be, obviously the last 4 years went really well, else everyone wouldn't have come back. So this is terrific, and it's really important work. On my very first day, I met with the VSO leadership. You can see Sherman's there to the right. And I just wanted to acknowledge that that was not by accident, that I view our relationships with PVA and the other VSOs as absolutely vital. They are our partners. Without their help and support, we would not be able to do the type of work that we do every day. And I consider their counsel and advice and guidance extremely important to the success of our organization, and look forward to continued relationships with them. In terms of where the VA is headed in this fiscal year, I think everybody knows that's been paying attention to what's been happening at the VA. The VA has come through a very rough time over this past 18 months, and this is a year where we're going to be building upon the momentum to build back the strength and confidence that people have in the VA health system. We're going to do it in a number of ways, and we're making some terrific progress. First thing we have to do is we have to fix our access problem, and we've come a long way in making sure that veterans who need care are getting the right access, but we're not there yet, and we're going to continue to make sure that we have the right type of care when veterans need it. Secondly, we're going to continue to grow and invest in our staff and our physicians. We're hiring new people, we're training new staff to make sure that they're trained in the best ways to care for our patients, and we're going to make this the best place where any healthcare professional can work in the country. Specialty care services are really the core of what we do at the VA, and it's what VA does in particular in terms of its emphasis on treating veterans. My role as Undersecretary of Health is to make sure that we have the right resources and the right allocation of staffing and equipment to make sure that specialty care services are providing state-of-the-art care.
I was invited to give a talk on the mechanisms of head and spine injury and vehicle crashes for this Paralyzed Veterans of America conference. And I appreciate being able to talk on both brain and spinal cord injury and how they occur in vehicle crashes. Our projects include grants from the Department of Transportation and military and Veterans Affairs funding agencies that look at vehicle crashes in particular as a cause of brain and spinal cord and spinal column injury. And that is what the results of an overview of the results today I was presenting for the conference so that they can understand particular mechanisms of brain and spinal cord injury when it comes to vehicle crashes. One of the wonderful things about the Paralyzed Veterans of America conference is that it does bring together all of the different disciplines, and so that you have service providers of physicians and support staff, nurses, caregivers, physiatrists, physical therapists, all of those people that have a hand in helping the paralyzed veteran in their recovery.
I very much appreciate the opportunity that the Paralyzed Veterans of America have given us to meet here and to talk about what we can do in order to improve the health care for our nation's veterans. As a matter of fact, this year our team presented some information regarding transdisciplinary practice, and the outcome of that was that we're looking at developing a brand new initiative. As a matter of fact, we've had it underway now for a few weeks. It's a mobile laboratory for patients that have amyotrophic lateral sclerosis. These are patients that cannot get out of the home because they have obviously a malady that prevents them from coming into the clinic. And so we need to be able to do pulmonary function testing with those individuals. And in many instances, because they can't come to the hospital, we simply don't know how well they're doing. So in an effort to prevent these patients from basically falling through the cracks, what we have is an initiative in which we go out and we do the pulmonary function test, the exact same test that they would have done in the hospital, but done in the home. In many instances, these initiatives arise as a result of some of the deliberations that we have in meetings just like this one right here. It's a wonderful opportunity to be able to network. It's an opportunity to be able to collaborate, an opportunity to be able to bounce questions and concepts off of each other. And when we go home, we mull those things over. It may not seem like it while we're having those conversations, but we do think about them after we get home. And it's interesting how just little itty-bitty things will come back and will actually play key roles in being able to help us do a much better job in being more responsible to our patients as well as more responsive to our patients.
I've come to this conference every year, so it's my 5th year, and I really enjoy it. I look forward to it. In fact, the past 3 years I've submitted and presented at the event. I like the idea of doing my continuing education specifically in spinal cord injury instead of trying to find CEUs in presentations around home that really don't have anything to do with the work that I'm doing at the VA. I also enjoy the networking with other practitioners here, other social workers. I like finding out what they're doing at their VAs, sharing best practices. All in all, it's a very worthwhile and enjoyable opportunity. Thank you.
This is my first time at the Paralyzed Veterans of America conference. Will not be my last. I've got a lot of vital information so far and look forward to the other conferences coming up.
I find this conference to be very valuable, and I find this a very good educational opportunity for physicians like me. And I love the interdisciplinary approach to this whole conference because I do get to hear the perspectives of the different disciplines that are working with the spinal cord patients. I'm a scholarship recipient, and I look forward to attending future conferences also.
I really want to thank the Paralyzed Veterans of America for making this happen. This year we had a budget crisis, and if it wasn't for Mr. Sherman and all the leadership's advocacy, none of us would be here. And we really want to thank him for that. It really allows all of our team members to learn the state-of-the-art evidence-based medicine that they could help our veterans with. And again, if it really wasn't for the PVA's strong advocacy, none of us would have had the benefit of having this wonderful education, which, again, this is my 5th year, and every year it is getting better and better. And thank you so much on behalf of all of the VA Paralyzed Veterans of America. You guys are the greatest.
So I just